hyperhidronia, pulmonary hypoplasia, and this is called Porter's syndrome because it is agenesis. There is Murphy quintin. That's all. You have to know. It's not a rocket science. It's very easy. But you should not forget. I'm hammering you many times the connection between the urine and the pulmonary development and the amniotic fluid.
Does producing too little urine, does it not produce the kidney or only not the lung?
No, other way around. Because there is no kidney, no urine. Not that because of no urine, no kidney. No. Urine comes from where? Kidney. Not the other way around. You have no urine. He's asking less urine means no kidney. The other way around. Yes, that's not the less, whatever way it is. But kidney must be absent.
What's the condition with no
What? Agenesis. Is written over there on the top. Agenesis. So the first one, which is shown in your slide, is solved. Let's go back to the first one. Is mine or yours? Okay.
This one.
Everybody should say agenesis means complete absence. Hypoplasia is very similar to that, means less development. One is complete absence, agenesis, and one is less development. Both have oligohydramnion. Both have a pulmonary problem. Both are related to the oligohydramnion. Is that okay? So first two are solved. The second one, the third one actually, is ectopic kidney. You have gone through that lecture already. Ectopic kidney means it's a pelvic kidney, that which cannot ascend. The previous picture is showing you clearly. I have a picture too, but showing you that how the kidney ascend. It should be T, and in your PowerPoint it is corrected. T, it should not be. Ascend is the verb, ascent is the noun. So the ascent of kidney should be T, and it is corrected in your place. And you can see that from the pelvic region it slowly go up. If it does not go up, that translates into what we call as the ectopic kidney or pelvic kidney. Ectopic kidney or pelvic kidney. Okay? And one of the important part of that classification is the horseshoe kidney. It's written over here, horseshoe kidney. Now what happens to the horseshoe kidney? Who knows this horseshoe kidney? Have you heard the name horseshoe kidney?
Yeah.
No? You have not heard the name horseshoe kidney? Not done to you? It's impossible. Impossible. Nobody talked to you, Dr. Alina, or no horseshoe kidney?
No.
Okay, then I have to explain. I have nice photographs. Yes. When you see the kidney, try to follow it. I'll go through my PowerPoint. I'm not, I don't go with my PowerPoint. I love to explain first. What is a horseshoe kidney? The kidney is in the pelvic area. It's forming. Look at me. Kidney in the pelvic area. Then look at my hand. Then it goes like this way to the lumbar area. Kidney over here is closed. Now when they are closed, they may be joined together. The lower pelvic joint. And there is an artery over there called inferior mesenteric artery. So it is stuck. It wants to go, but it is stuck over here. Inferior mesenteric artery is the answer. So in the exam, if somebody puts a question on the horseshoe kidney in relation to the gross anatomy, he or she will be asking you which artery prevents the kidney to go up. Is the inferior mesenteric artery, not superior. Inferior mesenteric artery is over there. So remember the orientation of the kidney when it is ascending. It is like this, ascending. So when it is at the pelvic area very close, the lower pelvic, if it is fused, then the inferior mesenteric artery will prevent to go up. So that becomes the horseshoe. Why it is like when I'm doing that, you have seen the horse, their shoe, and they put a metal like that. That's why it is called horseshoe kidney. Are you okay with me? I'm surprised you have not heard that. It's impossible. Now, somebody told you like this or no?
You the first.
Horseshoe kidney?
only
No, no,
what's so
done.
hot?
I'm the first? Oh, okay. So you need some photographs.
Oh,
Okay.
good.
Let me show you some photographs. Sure, I have nice photographs.
Is horseshoe kidney also an ectopic kidney?
Ectopic kidney, yes.
It's also an ectopic.
Yeah, not all ectopic kidneys are horseshoe kidney, but the horseshoe kidney is ectopic kidney.
Yes,
That's a good point. That's a good point. Horseshoe kidney. Now you can see in the city, this artery, this is an artery, is the inferior mesenteric artery, and you can see the lower pole of the kidney is attached like this way. So this is the kidney. You can see it is, I have more picture. Can you see the two kidneys are attached at the lower pole? And here is the artery, which is the inferior mesenteric artery. Is written over there, inferior mesenteric artery. Now, look at this photograph and appreciate what I said. Initially, it is like this, very close. Then it goes up. Kidney over right kidney over here, left kidney over here. So the chances of lower pole to be fused is very much. This is called horseshoe kidney. Why it is horseshoe kidney? Because it looks like a metal, they put it in the horseshoe leg, horseshoe kidney. And which artery is preventing? Inferior
Inferior
mesenteric.
mesenteric.
The two kidneys merged.
Yeah. They're normal. Like I have horseshoe kidney.
Very well.
I have horseshoe kidney. You know that?
Oh,
I'm normal.
mashallah.
Mashallah. So anyway, it is a normal kidney. It has ureter, everything is okay. It just could not go to the lumbar area. That's all. Yeah.
Will it affect anywhere else, like the arteries or veins?
Anywhere else? What?
Like the big arteries or vein, would it compress?
Yeah. Everything is normal. Everything is normal.
So the renal vein is lower?
Okay, let me go through. I'll forget otherwise other diseases that we have to do it. Now forget about pancake kidney, cut it. It's not important for it. No need for it. Malrotated kidney, cut it. No need for that. Polycystic kidney, yes. Polycystic kidney is a genetically controlled. What happens is that there is a gene, you don't have to know that, but the gene is responsible. Again, it's related to the WT1 gene, which makes the kidney. Is related to it. You know, the fusion is happening with the ureteric bud, and the fusion and some problem, genetic problem is there, then the urine is not coming properly to the ureter. That leads to the cystic swelling. Cystic means swelling. Poly means multiple. Multiple swelling here and there. I'm going to show you for you to appreciate that how does it look like. Here, like a grapes. There are two varieties of this is you can cyst, multiple cysts over there. What is the problem? The fusion has a little problem. That means the urine is not coming out properly. So there are two varieties over there. One is called dominant, one is called the recessive. Recessive is for the children. A child is born with this kind of problem is real problematic. You have to think about it, that what to do with this now. Usually people remove it, put a transplant. In adult, I have one of my friends, he died recently. He had polycystic kidney, but it appeared in the adult, it's called the dominant variety. In the adult is always the dominant variety. And he died, he was with the, the therapeutic measure, people give to replace, but transplantation is the only answer. Very difficult to get in the adult transplant because priority is for the children. So if the kidney is available, I'm talking back in Canada, the priority is for the children. So if kidney is available, they give it to the child. There is no wasta or anything. The child is the priority. Okay, so he was in the line. He was only two more kidneys before he died. Actually, he was very close to the the list, but he died. That's the adult variety. He was diagnosed at the age of 52. He died 2 years back. So this is the dominant variety, or the recessive variety for the children. Will you remember that? That's all you have to know. You have to know polycystic kidney. This will be dealt in detail in year 3. You have the renal system again coming. And I saw their PowerPoint. They go in detailing of that, so I don't want to talk about that now. Because unnecessary burden is no need. If they show that anybody is asking you, do you know any problem of the kidney? He said, yes, I know many problems. One of them is polycystic kidney. There are 2 varieties, dominant, adult, and the recessive is the children. That's all. And what it is, there is a cystic swelling because of the urine is not coming out properly. That's all. And I'm not going to the PowerPoint because I'll go to the PowerPoint at the end, okay? And finally, you have the double ureter. Is written over the double ureter. Double ureter from one kidney. I should have written over there, but there's no need of writing. Not double kidney, double ureter from one kidney. What is the problem, you tell me? Where is the problem? Quick. Where is the problem in the double ureter of the kidney?
The GDNF gene.
One more time.
GDNF gene. Oh, WT1.
Where is the, no, I'm not talking about, where is the biological problem?
Mesenteric duct.
Mesenteric.
Yeah,
Mesenteric duct.
man, this guy is too good. Problem on the mesenteric duct, that's all. It's just bifurcation very early, it should be one, but you know, there are the 2 genes are working at the same. You remember GDNF is responsible for pulling at one place. If it is pulling in 2 places, 2 ureter for one kidney. And it's very common. I'm going to show you that. Okay, let me show you that. Very good, well done. Let me show you that picture. I should have. Yeah, this is there. You got it? Ureter over here. And in fact, I should have a IVP. Yes, you can see that. There is somewhere over here. Can you see the ureter? 2 ureters over here? One over here, one over here. This is, and if you may say that the patient is having any problem. No problem. It's blessed, the 2 ureter. Urine should be more, I don't know. Urine should be more. But anyway, this is the possibility over there. Now, the most important disease is not listed over here, but you can add that. Where is that? This one. I put it in a different way because it needs some understanding. Wilms tumor is the final one. I did not put in the list for a reason, because I want you to understand that and give a priority of this one. Out of all the diseases, Wilms tumor is common in the child is born with a kidney tumor. And what is this? Why I put it differently? Because you can understand. Think about it, an organ which is growing. So it was born, it was developed, and then after 8 weeks it is growing. Why it is not growing from here to there? Some gene must be suppressing gene. Suppressor gene, it's called suppressor gene. Otherwise the kidney will be from here to there. Every organ will be from here to there. Which is not bad, you know, everybody will be like this way, all the organs are, one is liver is over there, from there to there. But some gene is the suppressor gene. Now here is we talked about WT1 gene. Actually, what is the name of that? Wilms tumor gene. WT1, remember? I told you the WT1 gene, that's called Wilms tumor. It has a suppressor. Let's read it properly so that everybody should understand. It's very interesting. Now read it. Some genes control when our cells grow, divide into new cells and die. Certain genes that help cells grow, divide or stay alive are called oncogenes. So oncogenes there is a suppressor. For example, a small number of Wilms tumor are caused by changes in mutations or loss of the WT1 or WT2 genes, forget about WT2 gene, which are tumor suppressor genes. Absence or mutation of this tumor suppressor gene will lead to the tumor. The suppressor gene in mutation is some problem is there, then they are better. That's called Wilms tumor. And it's very common in the children. A children is born with some swelling over there. Of course, the kidney is at the back side, but you can feel the swelling even from there. You have to do the operation very quickly. Okay? So that's called Wilms tumor. And that's why I put it separately, but the reason is, it is related to the WT1 gene, which is responsible for the growth of the kidney. Everybody should be clear about that, what I said. I make it a little fun because organ should be very grow, but it has a meaning that every organ should have a suppressor gene to make it look like kidney. When it is done, suppressor gene is finished. Are you with me? Do you need more explanation? No. So let's go to the PowerPoint. And remember, then my next job will be to make you understand of the lower part of the urinary system. Okay, I just give you a concept and that's it. I'll finish it next week. Okay. So let's go to the PowerPoint. And some of the thing I ask you to. So I started over here to just the ascent T is the correct answer. I showed you this one. Now it's very clear to you. Agenesis means complete absence. Hypoplasia means less development of the kidney. Both will trigger to form the oligohydramnias. Lung development will be problematic. And the other part is that the agenesis of the kidney often is called Potter syndrome. So if anybody is asking Potter syndrome, agenesis goes. We sometimes put the Potter syndrome. Many of the syndrome is not good for you at your level. We give the disease name later, but we'll explain. If I put in the exam, definitely I put it in the agenesis. Is there, so you can answer it. I'm just saying that the name is not important. Ectopic kidney, everybody understand kidney ascent, but if it does not ascend for some reason, it's an ectopic kidney. A good example in our lab, anatomy lab, has an ectopic kidney. Everybody should see that. But more important is the horseshoe kidney, which has some thought process. It cannot go, it is an ectopic kidney, but it cannot go up because the lower part fused to form the horseshoe, and because of the artery which prevents it flowing. Same like, the ductus arteriosus. The nerve is renal laryngeal nerve. Yeah, so same concept is there. Pancake kidney, I ask you to remove. Malrotated kidney has to remove. Polycystic kidney is important. And where the cystic swelling is there, it has the two varieties. Dominant is the adult variety and the recessive is the younger generation. And because of the urine is accumulated on the kidney, it needs some therapy or transplant. Double ureter is the ureter because of the two ureters from one kidney because of the maldevelopment of the mesonephric duct. Agenesis, so I don't have to read that too much. Oligohydramnias is there because little or no urine is in the amniotic cavity. Potter syndrome, everything is there. Now cystic kidney disease, autosomal recessive PKD or polycystic kidney is a rare inherited form. Symptoms of autosomal recessive begin to the earliest months of life. That means in the children. Okay? The dominant is over there in 30 to 40 years. My friend was 50 years or 42, 45 years old when he developed this thing. He died recently. But this is the adult variety. You need the transplantation. This is the polycystic kidney. Cut this one, hydronephrosis will be dealt in the year 3. So we are not interested. This is a hypertension type of thing. Don't worry. Just remove it. Remove it. Wilms tumor, keep it separately. Why? Because of this, cause of it. This should be absolutely clear to you. What is the Wilms tumor? The W3 gene is the name itself is called Wilms tumor gene 1 or gene 2, but that is responsible for the formation. It can formulate, it is modulated or controlled by a tumor suppressive gene. If there is a mutation on this tumor suppressive gene, the W1 gene will be taking care and forming the tumor. The name of that gene is Wilms tumor, meaning that it can grow enormous, but it should be suppressed by a suppressor gene normally. If there is a mutation of the suppressor gene, that will lead to the Wilms tumor. Now, I have done my job in terms of the kidney and the upper part of the kidney, ureter and this. Not only how they are formed, we try to understand like him, mesonephric duct is responsible for the ureter both in the male and the female. In the male, it produces additional thing, which is this vas deferens. That concept is nicely given to you. Nobody can challenge that. Right. Now get ready for the lower part. I take a deep breath because it's little complicated, not there, but I want to make it very easy. Now remember the fact, all of you should, but don't sleep, please. Don't sleep. Okay. Okay. Upper part of the kidney formation urinary system is related to the mesoderm. Upper part of the kidney is related to the intermediate mesoderm and mesonephros, pronephros, metanephros, all the nephros type of thing is the mesoderm. Ureter is a mesoderm. Up to ureter is a mesoderm. Then what happens to the lower part? It comes from the endoderm. First concept. One more time. When we say that intermediate mesoderm is responsible for the urogenital system, we talk about the upper part of the urinary system. That's it, up to the ureter. Period. Lower part forms from endoderm. Now, what does it come to your mind if it is the lower part of the endoderm we are talking? Which system comes to your mind? Is the intestine. Isn't it? Intestine is the endoderm. I told 10 times.
Yes.
Remember intestine?
Yeah.
Although you have not done the GI system, so that's the difficulty for me to explain to you. But take it from me, and when you go to the GI system, the first block in the spring, you will be encountered with many things, including embryology. And I will go back to you and say that this intestine is coming from the endoderm. Endoderm, nothing to do with the mesoderm. First concept. Now the GI has many things we call foreguard, midguard, hindguard, all kind of guard. Guard means is the intestine. Coming like this way. The lower part is called the hindguard or sigmoid colon. Have you heard the name sigmoid colon?
Yes.
Like we have rectum, we have the sigmoid colon, rectum. You know that already, the prior knowledge. Now the very lower part actually is attached to another endoderm called cloaca. This is the only concept, it's difficult. And if you are a teacher, you know that there is a challenge between you and me is that I have to convey the message in the best possible way so the student understand. I could show you a couple of pictures and run away. That will not help you. I will make sure that you understand. And therefore I have 15 minutes. I kept it purposely to make you understand. Lower part of the urinary system is coming from the endoderm. Lower part means what? After the ureter. That means bladder, prostate, then urethra, all coming from the endoderm. Endoderm means intestine. I'm just talking about the lower part of the intestine because it has to be lower, it cannot be upper part because we are talking about the lower part of the urinary system, right over here. So lower part of the urinary system comes from the endoderm and comes from the intestine. So what is the correlation of that? So lower part of the intestine has this structure like a balloon, which is called cloaca. C-L-O-A-C-A. C-L-O-C-A-C-A. Cloaca. 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 Tonight you have to remember this name, cloaca. I like that name. Cloaca. Beautiful name. Cloaca. tonight. Now what does it? It's like a balloon. So half of that joins with the intestine, and half of them will form the urinary bladder, prostate, and urethra. Period for today. One more time. What I'm saying is the lower part of the intestine is formed from endoderm plus another endoderm, a specific thing like a balloon called cloaca. This cloaca will be divided into two parts. The anterior part will be forming the bladder and the urethra and the prostate. The posterior part will join with the intestine, with the endoderm to form the rectum and the anal canal. So the septum which is completing it, what would be the name of that? It's called urorectal septum. Uro means urinary bladder, rectum means the rectal part. That's it. If you know this, bingo, I'm happy today. On my birthday, I'm happy. Now you need photograph, very classical Paul Ganguly photograph, you need it. Okay, let's do it. Yeah, this is the normal intestine. All of you see that the classical way. I'm not showing any mesoderm over here or ectoderm over here. I'm showing you the endoderm, which is the classical intestine, and it has to be attached to the yolk sac one time. I'll tell you those things. Don't worry about this term. GI system will explain. But I'm talking about this part. Can you see this part?
Yes.
This part joined with this way. Now try to understand. Can you see the cloaca? Is endoderm, hindgut is endoderm, like a balloon. Now it will be divided into two parts. Anterior part will be called bladder, prostate, and the urethra. The posterior part will join to form. So you need another photograph from me, and that is it. You like my diagram?
No.
Urogenital. So the one which is the urogenital sinus, you see, will form the urinary bladder, prostate, and urethra for the male. For the female, the vagina it will be coming. That's why it's called genital. Uro means bladder, and genital means either the prostate or the vaginal wall is coming from the urogenital sinus. That is the story. You can see now the urethra will be coming over here, and there is a little protrusion. We'll talk about that later next class. But this is the division of that. And what is the division over here? Name? Urogenital septum. Urogenital system. Urorectal, I'm sorry. Urorectal septum. Okay, this is the rectum. Uro means urogenital sinus or the urinary system. And the anterior part will be called urogenital sinus because it produces genital system for body. Now I leave it for the time being. It needs a little bit to appreciate what I said. If you understand that, that's enough for today. I'm not going to talk about anything else today. I'll come back to go from there, okay? Because there are many things to talk about that, and it will be easy for me to explain. But this is, I go back to you, my slides, okay? Appreciate my diagram. This is when I come back to you in springtime, this will be my first slide, and I will explain how the intestine is there. You may ask right now, Dr. Paul, this intestine is outside the body.
Yeah.
Yes. Then it goes back. Very interesting. Intestine, all of us were born with the called physiologic hernia. The intestine was outside. And the story comes back. And if it does not come back, then there's a problem. So we'll talk about those things. Very interesting. This is the normal. And I'll start with that earlier. This is just showing you endoderm. Just showing you endoderm. And what I said, the lower part of the endoderm in the hindgut, lower part of the will be joining with another endoderm called cloaca, like a balloon. Cloaca. you can understand why we need another endoderm, because the anterior part will be forming the bladder and the urethra or the prostate or the vaginal wall. So we need it. We need the cloaca. And the septum is called urorectal septum. And it has to be in my diagram, and many things we'll be talking about next week. It has to be separated completely. Now tell me, in my diagram, I say, I love my diagram. See, I did not copy from any book or anything, my imagination, that's how it is. It is so good. So good. Now, if I say to you, let's see, I'll leave it to you for understanding for today. I'll go away because I have other classes. But with a question to you, let's see if for example, the septum is halfway complete, and it is very common, not uncommon, what will happen to a female person, female baby? One more time. I'm saying urorectal septum should be complete. In my diagram, it's complete. From here to here, it's complete. If it is not complete, what will happen?
The vagina and the rectum will be open.
Very good. Give a big hand to what he's saying. Vagina will be over here, because in between the bladder and this thing will be vagina and the uterus and all kind of thing will be here. So the fecal material, if a child is born, a female child is born, with the fecal material is coming from the vaginal wall, immediately suspect that the urorectal septum is incomplete. Make sense? You are thinking very correctly. So these are the reasons the embryology is so important. Particularly for the pediatric people who want to do pediatrician or maybe pediatric surgeon, think that carefully. And it's not uncommon. Not uncommon to have halfway the cloaca is not divided. Is it okay with you?
Yeah.
Clear? Thank you very much. That's good enough for today.
Thank you.
If you think about the coming up slides are actually the development of the bladder. And I will explain to you more on this. In the book is writing like this, you can see that I'm not wrong. This is the cloaca, and you see the urorectal septum. Can you see the urorectal septum? One minute please, just look at this diagram. You can see the urorectal. I'm going to explain that next week, but my diagram is more prominent. If they put the cloaca like this, I put like a balloon, my own creation. And then urorectal septum is there, and then you see the urorectal septum is separated completely now. So one is urogenital sinus, one is the joining with the rectum and the anal canal. Like previous diagram, you can see that this is the normal. But if I leave you with this diagram, you will not understand, you will not enjoy. Need my diagram in a big way, like a very close view what is happening. These are for artistic way. These were done by artists, they were not medical people. Only thing, the editor is a medical person, but he wants to publish the book as quickly as possible. That doesn't happen. We need a real one, right? Thank you very much. Thank you very much.
Doctor, can you repeat the concept of the kidneys ascending real quickly?
One more, I can't hear properly.
Can you repeat the concept of the kidneys ascending? Ascending of the kidney.
Horse kidney?
No, the ascending of the kidney.
The normal ascending.
The normal ascending.
Yeah, normally.
The sort of the.
Yeah.
He's saying like, how does it happen?
Oh, why do you have?
Yeah, can you just repeat the concept?
Hang on, you should ask this type of question. Yeah. He's saying why it is ascending. That's a question that, what is the reason for going up, right?
Yeah.
That is the question. It goes with the surrounding structures are there and the intra-abdominal pressure. You will understand that. In the GI system, I will explain more. A very good question. Why it is ascending? Remember, it is ascending the posterior abdominal wall.
Yes.
And surrounding structure will be there. Like when there is a mesonephros is gone away, there is a vacuum over there. the pressure is up, and there is a space over there. It goes up. You got my point. Mesonephros is mostly gone. Testis is coming down.
Yeah.
There is a vacuum. There is a space over there.
So it like sucks the kidney.
And there is an intra-abdominal pressure over the time because anterior-abdominal wall will be formed. So the pressure is there and there is a space over there. So it's slowly tendency to go up. We'll explain more.
Okay. Thank you, doctor.